So tell me about your device. What's it called and how is it different?
So our device is called Surplux Duo. We're a drug coated balloon. It's different because we're using two drugs, encapsulating two drugs using nanoparticle nanotechnology. In drug coated balloons, most of the technologies today are one drug. And I think that's a huge limitation. In the pharmaceutical, you already see the combination of multiple drugs to treat diseases. So why limit that just for the pharmaceutical, not bring it to the interventional cardiology? The reason that we cannot bring it to the interventional cardiology is the incompatibility of the two drugs with one excipient. It just takes a lot of work and R&D. And because of our nanoparticle is agnostic to drug, so we have the capacity to encapsulate two, and we want to bring that technology for the interventional or interventionalist.
What is the difference between working with us on that transactional basis of working with several people at NAMSA versus working with us using our APEX program model?
Your APEX program is very important to us because that assessment, that product strategy comes from you, but you cannot give us that strategy without a thorough understanding of what we're trying to achieve. And we rely on that strategy back as a roadmap for us to bring that to our investors and say, here's how are we going to do our communication or conduct our communication with the FDA or notified bodies. And with that, it becomes a solid tool that we bring into our board members, our investors, and that credibility just grows about our ability to execute as entrepreneurs and also how their money is being spent in our organization. The APEX program allows me to have one person that I talk to internally to your organization, bring in the right expertise and the right people. Versus going the other way where you have to go to preclinical services and have to rebuild that relationship. You have to find, first of all, who to talk to, or your biocompatibility, and then who to talk to. From that perspective, it's a lot of inefficiencies.
So how does the APEX program solve that problem for you?
First of all, just from a business or agreement perspective, let's just say we have different vendors. We have to do multiple agreements. You negotiate the terms, negotiate the budget, and then that process can take, a week or 2 weeks. It can go back and forth. For example, between Advanced Nanotherapies and NAMSA, we have one overarching agreement. There's one less problem for me to worry about than just negotiating these contracts as a CEO.
So, as an APEX program client, you have one point of contact at NAMSA to be your leader for everything you're doing with us across regulatory, biocompatibility, preclinical, strategic, etc.
Yeah.
How does that improve the overall efficiency of the operations of your company?
Tremendous. I think to me, we have weekly meetings. We have a plan that we follow. We can see a little bit our future better, right? Because we work truly, hand in hand. So now we solve one problem today, let's just say preclinical services, but we know the biocompatibility will come next. And the person who's sitting on the APEX program, they know internally they're also their lead time.
So it's about predictable timelines.
The more we can predict, the more we're better at using our money. We're better at telling the story to investors. Our credibility becomes higher too as management and executives. But if we are delivering predictable timelines, my credibility as a CEO just goes up, and that's very, very key. And that's value to me, not a cost.